Good morning, everyone. Dr. Zach Long here, Doctor of Physical Therapy and lead faculty for the Institute of Clinical Excellence's Fitness Athlete Division. Today is Friday. You know what that means? It is Fitness Athlete Friday. And today we're going to be talking a little bit about essential strength and conditioning reads for the modern physical therapist. So in the PT world, we've been really fortunate over the last few years to have a lot of growth in clinicians that understand the need for high-level strength knowledge to treat patients of a wide range. And we understand that there's a huge problem in the physical therapy industry of chronically underloading our patients and not providing sufficient stimulus for them to create adaptive changes. And so, when Doris comes in and is having some hip pain, we're telling Doris, hey, we think your pain is coming from, you have some lack of strength in your glute med, and we get Doris doing some hip clams with the yellow TheraBand, something that she could do probably 150 reps of, even though she's not incredibly active, and we have her do 3 sets of 10 with it. And we don't provide sufficient stimulus to get people to actually be stronger. So it's been really cool to see this shift within the physical therapy community where we're putting forth a lot more effort at properly prescribing exercise. And as the movement experts that APTA wants to put ourselves out there as, this is something that we really have to have an incredible amount of knowledge on. And it's something that myself, Mitch, Ryan, Jeff, and Alan, we all get tons of questions and tons of people wanting to know, hey, where do I start? I didn't get this in PT school. I've been practicing for a while. I don't even know where to start on beginning to properly load patients. So I'm going to take you through 5 journal articles that I think are great little pieces to just start like dipping your toe in the water there, to have a little bit better understanding of what we're talking about when we say a strength-minded physical therapist. If you're tuning in live on Facebook, I'm going to drop links to these articles on Facebook. If you're listening to the podcast, or you're live on Instagram with me here too, then you'll have to just Google these yourself. So let's dive into this a little bit. Let's look at first what's the problem. And there's 2 articles that I really like to reference when I'm discussing the problem of strength and our need to have these skills in our pockets as physical therapists. The first is by Jill Cook. The title of the article is Rehabilitation Will Increase the Capacity of Your Insert Musculoskeletal Tissue Here, Defining Tissue Capacity, a Core Concept for Clinicians. So basically in this little research review, Jill Cook, the tendon guru, kind of breaks down what she believes is the root cause of so many acute traumatic musculoskeletal issues. And she says that an acute injury is due to a loading event beyond a tissue's capacity. So think an athlete goes into the gym, is doing bench press with a weight that their pec's not ready for that day, and they end up tearing their pec. Or somebody's training for a marathon, they go run the marathon, and they end up developing some really acute tendinopathy because that tendon was not ready for the amount of load to be put on it. Or somebody was highly deconditioned, and because of that, their tissue capacity was really low, and they end up getting some sort of injury as a result of that. And then in this article, Jill Cook basically makes the argument that our rehab must be aimed at building back the capacity of those tissues to meet the demands that the individual is placing on those tissues. And with that in mind, we need to consider the time, intensity, and skills required in the sport, she says, and outdated passive therapies, biological injections, and loading that is not progressive cannot deliver this outcome. I love that last little piece there. So we as modern physical therapists a lot of times want to talk bad about people that do ultrasound still. Or we want to encourage our patients to not get cortisone injections. Well, she calls both of those people out in this article, but she also calls out those of us that are not loading in a progressive manner and basically says that if you're not doing that, you're behind on the times there as well. Then the second article that kind of, or second series of articles, we'll say, that kind of outlines our need to really be more focused on building strength in patients is going to be the work of Tim Gabbett, who's looked at the acute to chronic workload ratio. And we've talked about this on the PT on Ice Daily show multiple times in the past between myself, Mitch, and Ryan. But Tim Gabbett's done a lot of work on this. There's a number of studies that have basically, across these studies, he's been able to find that when we get acute spikes in an individual's training volume, that's when injuries are more likely to occur. So say somebody's been running 10 miles a week for the last 4 weeks, all of a sudden they do a week where they run 15 miles. That acute to chronic workload ratio has this big spike in it, and that basically led to these tissues being a little bit overloaded. And he's tracked that in some rugby players and some other running athletes. The research in this acute to chronic workload ratio stuff is really good. A lot more is coming out. Even things like finding that people that have a high chronic workload ratio are more resilient against injury. So if you're somebody that's highly trained, has been training at really high mileages for a long time, then you're somebody that's body is going to be more resilient against injuries. It's been taken to looking at things like heart rate variability combined with acute to chronic workload ratios. And basically some other researchers found that when there's an acute spike in workload and when there's alterations in an individual's heart rate variability, that's even more indication that an injury might be coming around the corner. These are a lot of things that we talk about way more in depth in the fitness athlete courses. But Tim Gabbett's work is definitely something you want to check out. And I think that combined with Jill Cook's work is basically laying the foundation for why we have to have this better knowledge around strength and conditioning principles. From there, the next study I think is a really great one. I think it should be a must-read for all physical therapists out there. Is an article by Brad Schoenfeld. Brad Schoenfeld is really well known in the muscle hypertrophy world, and the article is the mechanisms of muscle hypertrophy and their application to resistance training. So in this article, Brad Schoenfeld basically goes back through all the research that's ever been put out there on muscle hypertrophy to really dive into that and gives us a lot of good takeaways as physical therapists behind how muscle hypertrophy happens and what are the best practices to create muscle hypertrophy. So he starts by talking about the different types of muscle hypertrophy, sarcoplasmic versus myofibril hypertrophy. He takes us through the mechanisms by which muscle protein synthesis is increased. When muscle protein synthesis is increased, we then have a larger ability to potentially create hypertrophy changes. And so he's talking about things like cell swelling, hormone release, etc. And then he really gets down into the practical stuff as well, where he starts talking about the intensity, the volume, the rest intervals, frequency, exercise selection, rep speed, and whether or not we need to hit failure to create significant hypertrophy changes. That is an absolute must-read if you're wanting to dive deeper into strength knowledge and better prescribe exercise as a physical therapist. Up next, article. The back squat, a proposed assessment of functional deficits and technical factors that limit performance. Obviously I'm a little bit biased. I think the back squat's one of the best exercises, if not the best exercise ever invented. But I think that when a physical therapist can really break down an individual's back squat, that they have the ability to look at a huge range of human movements and transfer their knowledge of the loaded squat variations to being able to understand a lot of other movements as well. And this article just does a great job. It's actually 2 articles of diving deep into squat mechanics, looking at the demands on certain tissues. Are deep squats going to stress the meniscus, the patellofemoral joint, the articular surfaces, beyond that they can recover from? And he looks at, there's a bunch of authors on this paper. They look at what is thought to be proper technique with the back squat. How do we assess the back squat, and what are the common faults that we see with the back squat, and then what do we need to address when we see these faults? So just from an overall picture of reviewing the squat as an exercise and how to take a look at it, that article is a great one to start with. The final research article I'll talk about today is by Michael Ryman and Daniel Lorenz, and it is the integration of strength and conditioning principles into a rehab program. This is a great article. Daniel Lorenz also wrote a second article that's also really good on periodization that I would recommend checking out, but we're just going to talk about this one for right now. They basically open their abstract with this sentence. Rehabilitation and strength and conditioning are often seen as 2 separate entities in athletic injury recovery. And that's something that a lot of people come to Mitch and I as people really trying to push this fitness athlete division and really trying to spread knowledge around it. They come to us and say, man, we love what you're doing, helping to bridge the gap between rehab and performance. And you want to get Mitch and I fired up. You start talking to us about bridging the gap. Because Mitch and I don't like talking about bridging the gap, because we truly do not believe that there should be a gap in our knowledge as physical therapists and a strength and conditioning professional knowledge as well. There should not be any gap. And we really hate the term bridging the gap between rehab and performance. Because as the movement specialists in the physical therapy community, that should be in our wheelhouse. And we should have these pieces of knowledge really, really down. This article does a great job of summarizing so many different strength and conditioning principles. I think if there's one to read after today, it's probably this one. But basically, they start their argument with as physical therapists, we need to start our assessment of an individual by looking at them after an injury and determining what are the demands of the sport, or we could say the activities of daily living that this individual has that we need to be preparing them to go back for. Again, their tissue, if we go back to Jill Cook's work, their tissue capacity is not at where their demands are. So we don't just start randomly strengthening them. We need to look at where they're at now, where do we want them to be, and develop a plan to build up that tissue capacity to get them back to that area. And that's one thing I got to shout out Mitch here on his rehab EMOMs, which are an incredibly thoughtful thing to do when Mitch's patient population is always obviously very heavy on the CrossFit side. But using these rehab EMOMs is an excellent way to specifically start to address the demands of the sport of the patient population that he treats. So CrossFitters are coming in, and let's say an average CrossFit workout might look something like this. In 10 minutes, do as many rounds of 5 overhead presses, 10 overhead squats, and 15 pull-ups as possible. So we've got 3 different exercises providing significant demands around the shoulder joint, and what's the typical PT prescription going to be? Somebody's going to have them do, let's do 3 sets of 10 of shoulder external rotations. Let's do 3 sets of this, 3 sets of that. Well, Mitch came in and said, look, over the course of this 10-minute AMRAP, this person's getting in a lot of work. Let's better match the demands that are happening on the shoulder. So how Mitch is going to program that is he's going to set a 10-minute EMOM. So every minute on the minute, you're going to do as much work in this one exercise as you can, or as many reps as he prescribes. That way, during the course of 10 minutes, Mitch has people consistently working in the demands and energy systems that those muscles would kind of require when somebody goes back to CrossFit. So rather than breaking those up and having these long rest periods, which doesn't exactly match up to what we typically see in CrossFit workouts, he's developed a way to make rehab more fun and better match the demands of the sport. So how we're going to address 2 people with different sports backgrounds might be considerably different, even if they come to us with the same injury. So if an Olympic lifter comes to me with some shoulder instability versus a boxer, a boxer needs to be able to throw hundreds of punches. So we might actually be addressing how their shoulder functions differently than how a Olympic lifter does. Who an Olympic lifter needs, a set of 3 or 5 is a big set for them. So they might be somebody that I might program their work to be more like really heavy bottoms-up kettlebell presses for a lower number of reps compared to somebody that needs to be working more on some higher-end stuff, some more volume. Let's try to match the demands of the sport a little bit better. They then dive really deep into training program design principles, and this is where I think as physical therapists we really need to focus. So they talk about multiple different training principles, and I'm going to start with one that's individualization, which is something that I think most of us understand in physical therapy, is that all individuals are going to respond differently to training programs. So 2 people that come to us with the diagnosis of rotator cuff tendinopathy are going to have different needs. One person's rotator cuff tendinopathy may have come from being chronically overloaded. One person's may be from being chronically underloaded. One person might have weakness in their posterior rotator cuff. Another person might have significant thoracic mobility limitations. And we need to individualize individuals' training programs like we talked about earlier with the Olympic lifting and CrossFit examples. The next training principle they discuss is progressive overload. And we talked about that earlier with was it Jill Cook's article? I think it was Jill Cook's article. We have to be providing sufficient stimulus to the muscles, to the tendons, ligaments, whatever tissue we're aiming at to create an adaptive response. And that's the principle of progressive overload. And as individuals get stronger, as their tissue capacity goes up, we need to increase the demands that we are placing on that tissue so that we can continue to cause adaptive changes in it. And they talk about the principle of specificity and several others. Specificity we just kind of went over just a second ago. And then they're going to take a much deeper dive into a lot of things programming that's going to help almost any provider program better exercises. So that's a great article to look into. If anybody wants to go even deeper than these research articles, I'm going to recommend just one book, and that is The Scientific Principles of Strength by Juggernaut Training Systems. That's an excellent book that covers a lot of these concepts in here. It is written basically from a programming for powerlifting perspective, but a lot of the training principles that they dive really deep into, like the individualization, progressive overload, specificity, stimulus recovery, adaptation, that they discuss in their book are highly applicable to the physical therapist. Again, if you're on Facebook, check out the links that I dropped there. Otherwise, you can also message me and I'll try to get you links to those articles if you want. I believe that they are all open access when I checked earlier this week. I am heading out to Blacksburg, Virginia today, taking a look at Jason's Rehab of the Injured Runner course. So I hope to see some of you out there. Coming up in the fitness athlete division on, right here, June 2nd and 3rd. Mitch is going to be in Danbury, Connecticut. So check that course out. And then I'm heading on June 30th and July 1st. I'll be in Anaheim, California. So hope to see you out at some of the upcoming courses. If you want to check out course listings, check out ptonice.com. Have a great Friday, everybody.